Hello, my name is Victoria Certolic, and today I'm going to be talking to you all about the gap in women's healthcare. Now, you've all probably heard of the pay gap, and so you're probably wondering, what is a healthcare gap? Never heard of that. A gap in any way, shape, or form is simply one thing getting more precedence over the other. In this case, it is men getting better medical treatment than women. When it comes to healthcare, women are less likely to have their pain treated, have their symptoms taken seriously, or be given a diagnosis. Women's bodies and the conditions that affect them are less likely to have been studied in clinical trials, and therefore treatments are much more difficult to find. Even medical products used only by women, like the pill for birth control, are based on male bodies. In the case of the pill, they use male hormones. As I have said that women's pain is less likely to be taken seriously, there is a trend in medical history of dismissing women's pain. It is difficult to pinpoint whether it is gender bias, lack of medical research on women, or differences between how the sexes interpret pain, but what we do know is that when it comes to pain, women are treated differently. One study found that in the emergency department, women who said they were experiencing acute pain were less likely actually to be given an opioid painkiller, which are the most effective than men. In 2014, a study from Sweden found that women waited significantly longer to see a doctor and were less often classified as an urgent case. This can have fatal consequences, and in May of 2018 in France, a 22-year-old woman called emergency services saying that she was having severe abdominal pain, saying that it hurt so bad that she thought she was going to die. The 911 operator responded with, "You'll definitely die one day like everyone else." When the woman was finally taken to the hospital 5 hours later, she suffered a stroke and died of multiple organ failure. Esther Chen conducted a study and found that when women came to the emergency department reporting abdominal pain, they often assumed it was a gynecological problem, and then therefore they did not treat it with such severe painkillers. Also, women are more likely to receive anti-anxiety medications than men when they come to the hospital with pain, and they're often written off as psychiatric patients. As with any misdiagnosis, this can have fatal consequences. Now, however, a growing body of research is exploring implicit bias, which implicit bias is unconscious biases that are usually not linked to the consciously held prejudiced attitudes. And this contributes to differences in medical treatment. A 2015 study revealed a longer lag time from the onset of symptoms to a diagnosis in female patients. 6 out of 11 types of cancer, there was a lag in diagnosis of those. A 2013 study concluded that more than twice as many women as men had to make more than 3 visits to their primary care doctor for suspected bladder cancer. So did nearly twice as many with renal failure. Each year, an estimated 40 to 80,000 patients in the U.S. die from misdiagnosed medical issues. It took an average of 12 months for men to get diagnosed with Crohn's disease, which is an autoimmune disease of the gastrointestinal tract, compared with 20 months for women. Men diagnosed with Ehlers-Danlos syndrome, a group of genetic disorders that affect the connective tissue, it took them 4 years to get a diagnosis. It took women 16 years to get diagnosed with that. For women all around the world, it has been a very bad time for them. After all the information I've given you today, I believe that it is very clear that there is a health gap out there, no matter how many people want to deny it, and that because there's a health gap, there is implicit bias, and that needs to stop. Many lives are being ruined, and many lives are being lost because of this, and people need to receive training to learn how to overcome this so that lives can be saved.